Right. Okay, so welcome everybody to Sustainability in the Health Sector. We've got quite a few people online and a nice turnout, so welcome. This is our 9th Talking Point Tuesday, and we've got 2 more, and then having a break for the summer. And I see some familiar faces here that have been to a few. Oh, I might just have to use my... We've had some tech issues this morning, so it's been a bit frantic. Right, that's myself. I'm Marketing and Comms Manager for the Innovation Observatory. I'm standing in for Dawn Musgrave today, who's the Industry Partnership Lead. So a lot of you probably know her. Please reach out to her if you need any help with industry-related things. That's the last 2 that I just mentioned. We've got public-patient involvement and inclusivity in June, and then Horizon Scanning globally in July. We'll be having a break for the summer, and then we'll plan a load more events from September. As many of you probably know, this is the typical format of a Talking Point Tuesday. We've had the networking and refreshments. I'm doing the welcome now, usually Dawn, and then we usually have 3 speakers, but you're very lucky today. We've got 4 speakers, all giving their various expertise on sustainability, and then we'll finish with an expert Q&A. We've also got some SME slots available for with some of our speakers and team. I think some of the spots are still available actually. So if anyone would like one of those at the end of the session, just come over to me and we can get you booked in. And there you go. You can ask any question you like and they'll answer it in the best way they can. If they don't have the answer straight away, we will find it out and we'll get back to you. Industry, the resources that we've got on our website, we update these regularly. We have reports, dashboards, technology briefings. So anything really that you're working on or interested in, you can type into the search function and it'll bring up anything we've ever written about it, any horizon scans we've done, and that will be really useful to your business. That's what our web page looks like. The resources, we've been told it's a very easy search function, so have a look on that. And that's me. I'm going to introduce you to our first speaker, Fanny Burrows, who's Senior Lead at NHS England for Net Zero Research and Innovation. Morning. I think, are you on mute?
Can you hear me?
So we can hear you. Would you like to share your screen?
Of course, yeah.
Thank you.
It says disable share.
I'll stop sharing mine.
Oh, brilliant, thanks. All right, here we go.
Great, we can see it. Thank you, Fanny.
Brilliant. Thank you very much. Thanks for having me and good morning, everyone. I assume there's a big audience, but I can't see any of you. So it's a pleasure to be here. So I'm Fanny Burrows. I work for NHS England in the National Greener NHS programme. And my responsibility in the programme is to lead research and innovation. So what I wanted to do today is give you a very brief overview of the National Greener NHS programme, and then sort of deep dive a little bit deeper into research and innovation at the end. So first of all, the question is the why, and I'm not sure how many of you are aware, but there's a huge amount of evidence and awareness now that climate change is actually causing huge health issues and is an actual major threat nowadays in the 21st century to health. We know that air pollution, we know that major or extreme weather events have got major impact on health. We've increased respiratory diseases, cardiovascular diseases, and there's actual data and evidence demonstrating that. There was also a heat wave in 2022 that was linked to, claiming lives, but also causing major disruptions to healthcare delivery. So we know this is a major threat to today, to healthcare and good health. And we also know that it's disproportionately affecting the most vulnerable populations and specific socioeconomic background as well, therefore driving more health inequality. Now, the NHS and why. We know that the NHS and healthcare systems generally in the world account for around 4 to 5% of carbon emissions, greenhouse gas emissions that are leading to this sort of rising temperature and then climate change. So we know that the NHS is part of the problem with a huge amount of carbon emissions. But we also know that the NHS is really driven to try to find solutions to reduce this impact and therefore reduce the healthcare delivery carbon emissions and try to improve air quality and try to improve health. That could also be through, increased active travel, sort of better health, prevention, and just sort of better diet. So those are kind of examples of where the NHS has got major opportunities to try to reduce its impact on climate change. So the question is how, and the NHS published a paper in 2020 that was revised in 2022 called Delivering a Net Zero NHS that sets the NHS ambition to become a net zero, so it's sort of carbon neutral. And there are two major goals that are worthwhile really trying to understand. Is the goal of becoming net zero by 2040 for the emissions that we've got direct control over. And that's in this diagram, as you see on the left-hand side, the kind of scope 1 and 2. So it's the kind of emissions that are directly produced on an NHS site, and that could be, the fossil fuel that we burn on site, or the emissions associated to just running the facilities, the anesthetic gases that we use as well. And we also sort of take that into account as well, the electricity that is actually not produced on site but elsewhere, but that we then consume on site. So that's a major objective for 2040. And the second major objective is 2045 for the emissions that we don't have direct control, but we can strongly influence. And that's the major part of that kind of scope 3 emissions that you see in this diagram, which is related to how the kind of healthcare delivery runs through commission services, through some of the travel, but also majorly through the supply chain. So all the kind of product that we procure in the NHS. And that's a major goal to become net zero by 2045. So now in these slides, you can see the kind of two major goals, but you can also see what has been in place since that report was published in 2020 with the Health and Care Act in 2022 that actually embedded net zero into legislations and placing mandatory requirements on trust and ICBs to become net zero and to actually combat climate change. We also asked for every trust and ICB to have a green plan in place that demonstrate their strategy to achieve net zero and to reduce their carbon emissions. And those green plans are due to be refreshed this year. And there's a requirement to publish refreshed green plans by the end of July 2025 that sets the strategy for the next 3 years. So that's a major requirement on trusts and ICBs. And the last one worthwhile being aware of is the CQC, the Air Quality Commission, that has embedded sustainability as well in a kind of well-led key questions. So as you can see, that's followed with major sort of legislations and mandates to integrate net zero in the way healthcare is delivered day to day. And I think this diagram also reflects where the emissions are within healthcare delivery, which is really useful to understand where major actions can happen and where we can have the most impact. And as you can see, you've got quite a lot in the NHS carbon footprint, which is that objective by 2040. That also includes energy and some of the inhalers, but also you can see the proportion around travel. and the major 62% on the right-hand side of this diagram in blue, which is around the supply chain, and that could account for any supply chain, any products that is procured, but also medicines, medtech, and non-medical equipment as well. So this is a major part, and it's worthwhile being aware of that, because it accounts for a major amount of our carbon emissions in the NHS. And very briefly on the right-hand side, you can see that the emissions don't just happen in an acute hospital. It does happen everywhere in the NHS. Obviously, if we think of energy in an acute hospital, it's really high, but actually emissions can happen also in primary care, ambulance trust, and everywhere, community mental health. So it's really important to be able to develop green plan strategy and carbon emission reduction plan to be able to understand where the emissions can be reduced everywhere in the NHS and healthcare delivery. So the Green NHS programme is divided in different work streams that really have specific targets and goals to try to support the reduction in greenhouse gas emission, and a lot of work around estates and facilities, really linking to energy and energy reduction, travel and transport, as you can imagine, whether that's staff commuting, business travel, but also visitors. And patient themselves. Medicines, that accounts for around 25% of the emissions, so it's huge, whether that's direct emissions or indirect in the supply chain. Obviously, the supply chain I've mentioned before, the food and the food that is also eaten on site, and the food waste is often huge. Research innovation is how we can go further and sort of set the scene on what we need to focus on to drive carbon emission reductions in the future, and how innovative products can help us on our journey. The models of care is how we can move towards clinical, less carbon intensive models of care, and how we can potentially think about redesigning pathway, sometimes closer to home, to deliver safe care, but less carbon intensive care. Obviously, digital underpin a lot of the care, and how we can move to more digital care, but actually digital, resilient digital care, but also understanding the carbon footprint related to digital transformation as well. Workforce engagement is really important to support us on our journey, and then adapting. When I talk about resilience, is important to note that extreme weather event can affect healthcare delivery, and one of the examples is the 2022 heat wave that shut down the IT infrastructure in major London hospital, and we need to now understand how NHS services can adapt to changing climate and still deliver safe care. And obviously, data analytics and monitoring progress underpin all of our work within the programme. So very briefly, I thought I probably could give you some insights on what's been achieved to date. We've got some major successes that sort of are really worthwhile bringing up. And in the area of medicines, there's been a lot of work done to reduce emissions related to inhalers, particularly metered dose inhalers, but also working to reduce emissions of anesthetic gases. Anesthetic gases that are more potent than carbon dioxide. So it's really important to be able to tackle these. So we've been supporting the use of lower carbon propellant inhalers, but also thinking about the kind of decision and awareness with the patients, and the relationship between the patient and the clinical teams on inhaler choice, but also improving adherence and compliance to use of inhalers. Some of the work that's been on anesthetic gases is a statement that was released in 2024 to decommission completely an anesthetic gas called desflurane, and we've had major success, as you can see on that graph on the right-hand side, of reduced use of desflurane anesthetic gas. And we've also published earlier this year a toolkit to try to reduce the use of nitrous oxide. This is the gas that is used in the delivery of care, and to try to reduce the waste, often with nitrous oxide being delivered from manifold all the way to the patients, and actually identifying a lot of waste and leaks in that delivery system. So trying to reduce the waste, which would reduce dramatically cost, but also emissions related to nitrous oxide. So there's a lot of work going on in this space. The estate is huge, so there's a net zero carbon delivery plan that was published, but also some building standard to try to support estates team thinking about the decarbonisation plan from an estate perspective. There's been some major successes, particularly this year, securing a huge amount of funding to try to support trust, either through the public sector decarbonisation scheme or through solar panel installation or other funding to try to sort of reduce the energy consumptions and emissions related to energy in NHS Trust. So we've got a lot of projects going on and a lot of progress in the estates. In workforce, there's a huge amount of work that's happened to try to support trust delivering on their kind of green plans through engaging with the workforce, but also making sure that there's a board level lead in every trust and ICB to support the strategy. But also a huge amount of training, carbon literacy available, and also a leadership program for staff that really want to engage, Green Champion that want to engage with this. And every year, the Green NHS program has also had a sustainability clinical fellow program where clinicians join on a joint program with the Green NHS and another organisation to deliver on specific sustainability projects for a period of 12 months and try to sort of build that kind of leadership and sustainability moving forward in the NHS. And then on the sort of low carbon models of care is really trying to sort of develop a framework of understanding that the care needs can be quite complex and carbon related to that can be quite high. So it's really important to consider where the care is delivered, and this kind of steps framework was a good way to try to understand that care needs to happen at the right place. The treatment needs to be the right one at the right time, and trying to improve efficiency as much as possible in the delivery of care, and approaching it from a preventative aspect are really key systems change to reduce emissions and trying to embed net zero as a core kind of component of the care delivery. And then finally, how do we reduce emissions in the supply chain? This is the supply roadmap that was published and demonstrates the key milestones that we ask our suppliers in the NHS to meet, and particularly with the integration of social value, 10% weighting in the tender that was included in 2022, and that relates to combating climate change, so that is integrated into tendering process. But also the requirement around the carbon reduction plan, initially as for large contract in the NHS, but actually being now extended proportionally to all contracts. And if it's not carbon reduction plan, it's a net zero commitment. So all suppliers have to engage with this and with understanding their strategy to reduce their emissions themselves. So now briefly talking about research and innovation, we've got a range of different objectives within the research and innovation work streams, with trying first of all to embed sustainability criteria across research and innovation. And we've tested that with a number of programs, NHS England, such as the SPRI program, where we've integrated criteria and really engaging with innovators applying with the program on what they're doing around net zero as an organisation, but also from an innovation perspective and the impact on healthcare delivery. We've been trying to support innovation through funding or through programs to try to see how we can sort of stimulate the market for new innovations that support the net zero targets. And also trying to understand how we could develop capabilities around signalling the demand, what are the needs and challenges to become a net zero NHS, and where net zero innovation can support. And we've also worked with research stakeholders and research partners to support the scope or the development of research and innovation funding, but also by trying to stimulate collaborations between academic, clinicians, or experts in this field to create strong team and expertise and consortium to be able to then apply to this funding when they become available. So those are the kind of key objectives, and some of the work we've been doing recently is really trying to focus on signaling the demand for research and innovation. We've got a couple of pieces of work going on to try to sort of share those needs and those gaps we feel are very relevant to net zero objectives. Trying to support the acceleration of research opportunities, whether that's working with funders, stakeholders, or actual academics in this space, and supporting targeted activities or funding or other initiatives toward a more sustainable healthcare system, and stimulating relevant collaboration, as I've mentioned. So some of the examples are in these slides. So we've been working in NHS England with different teams to develop a research needs assessment paper that sort of sets where the major gaps and needs are. And then we've been working a lot with the funders, NIHR, UKRR being some of the main ones, and supporting some of their really amazing calls. The UKRI that was launched in 2023, I think, to realise the health co-benefit of the transition to net zero, and 2 hubs being funded to support the decarbonisation of patient pathway, but also the NIHR call that closed at the end of March. And then also our work with UCL Partner Health Innovation, where we stimulated collaboration around specific topics, and these were around estates and energy, and to try to bring together these academics with clinicians, with sustainability experts, to see what problems could happen, life problem within the NHS, and how academic could actually support these problems through small research projects. And also working across organisation in a sort of our joint drive to reduce emissions and to become net zero. So we organised a conference last year with UKRI and NIHR, and we're planning to do that again this year. So a lot of collaboration and stakeholder engagement. And then finally, on innovation, I thought that could be really useful perhaps for you to understand what we've been doing supporting innovation. And since 2021, I think, we've been working with the SBRI Healthcare Programme, so that's the Small Business Research Initiative Programme, to launch funding competitions specifically dedicated to net zero with specific challenge area that could be reducing emissions of specific anesthetic gases or intensive surgical pathway or supporting clinical community engagement. So you can see in this slide our 3 different funding competitions in the last 3 years to support innovations, and a huge amount of funding that was invested to support innovations. And I can always put some links if you're interested in the slide to see what's been funded in the past. There's no current funding opportunity, but just to give you a bit of a flavour of what's been done before. And perhaps some of the projects that were funded through this initiative. So for example, we supported Revolution Zero, that is dedicated to use reusable medical textile, drapes, PPE, ensuring that there's carbon efficient laundry services and tracking processes. So really interesting kind of displacement of single-use medical textile. APN is a really exciting organisation, platform organisation that is actually supporting delivery through drones of either medical equipment or treatments such as chemotherapy to remote island and area. And that's currently piloting a kind of transportation of blood sample for cancer patients between hospitals and diagnostic centre in London. Oops, sorry, I've gone a bit too quick on this one. And the last one is Definition Health, that is a digital end-to-end platform that patient can access to really support patients in their care journey. Also supporting them from home, from the community, with information, leaflets, resources, access, and as such, actually saving a huge amount of money to the NHS, but also a huge amount of carbon, as you can see in this slide. So hopefully that gives you a little bit of a flavour of the different projects that have been supported and the different initiatives that we've been doing in the research and innovation space. So I'm probably going to stop here. Thank you very much. And I'm very happy to talk to you. I think there's the one-to-one opportunities later that I'll be available if you wanted to have a chat. But I'll probably hand back over to you, Jen. Thank you very much.
Thank you very much, Fanny. That was amazing. Lots of good work going on there. And I believe you're going to be sitting on our, well, virtually sitting on our panel at the end for some audience Q&A.
Brilliant, yes.
Great. Thank you. Thank you. Right, I will just go back to sharing my screen. Okay. Right. I'd like to welcome Sophia Lentos. Are you there, Sophia? Hello.
I am here. Can you hear me?
Yes, we can hear you. That was
Wonderful.
probably no point in me sharing my screen there because I've got to hand it back over to you for
That's
that one.
okay. I'm less of a blur, hopefully, than that picture. Let me just try and share my screen. Is that sharing?
Not yet.
Okay, hang on. Has that come up?
Yep. There we go. Perfect. Thank you.
Fantastic. Wonderful. I've lost everyone now, so hopefully you can still see that. So morning, everyone. Thanks so much for inviting me. So I'm Sophie. I'm the Head of Climate Health and Sustainability at NIHR. And I thought I'd just talk to you today about giving you a bit of a brief overview on NIHR's position and what we're currently doing in the climate health and sustainability space. A little bit about sustainable innovation and what a sustainable SME could look like, and then a funding opportunity that was alluded to by Fanny, but I'll talk a little bit more detail later on as well. So just a bit of context, Fanny. I mean, Fanny did a great job in talking about actually why are we interested in this in terms of health, and as a health funder, why are we interested in this? Climate change has a huge impact on health, both in terms of the direct and also those indirect consequences. And yes, this is a really busy slide, but I think it just goes to show that absolutely everything sort of comes back to this pressure on the healthcare sector. And I think more than just sort of just recognizing that this is how vast and wide in terms of the areas and sectors in society that are involved in this, I think it just goes to show that the solutions also need to be as transdisciplinary as well. And this is a theme that we come back to in a lot of the research that we're funding, particularly in this space, is actually the collaboration between other sectors and other disciplines that don't normally apply to NIHR and don't normally work together, actually needing to come together on this agenda, because it is so vast and so diverse, and not only one person has the skills set and expertise needed for this. So we really need to come together to find the solutions. And I think this just highlights that in a bit more detail. So again, this is reiterating why is this important in terms of research and innovation. We know that there's huge gaps that exist in this space, and we don't even know where all of those gaps are. It's a really fast evolving agenda, and also we know that the consequences are happening now, so we also need to act fast. And just again highlighting that there's a real need for this multidisciplinary approach, because we need to generate policy. It needs to be high impact and solutions focused, because we know that we're dealing with the consequences now. So what's our approach at NIHR? So we've broadly taken the approach, we published our first set of commitments in this area last year, and we've taken this sort of 4-pillar approach, which broadly is how NIHR functions in terms of what we do. So first, we've got our sort of operational footprint, the very much our what's getting our own house in order, understanding what we can do to make sure that we're a sustainable organisation. Then there's the knowledge mobilization side of things. So as well as generating the research and innovation, we need to make sure that it's getting to the right people to make sure it's really maximizing that impact, whether that's the public, whether that's policymakers, whether that's clinicians. It's just making sure that that's targeted to the right people, and that's getting there to at the right times as well. Also, training and capacity is a really important element of this. It's an important part of what NIHR does anyway, but particularly in the climate and health and space, it's a really new area. So we really need to make sure that we're honing and creating the new workforce of researchers and innovators that can actually answer the much needed questions in this space. And then funding research. Obviously, we're a funder. It's a big part of what we do. And we've broken down how we fund research into 3 distinct areas, which I'll go into in a little bit more detail. But across these 4 pillars of our work are 2 cross-cutting themes that go across all of them. And that's making sure that across all of this, we're really ensuring that we're reducing global health inequalities. We know that climate change disproportionately affects the more vulnerable in society anyway. And we just want to make sure that we're ensuring across all the work that we're doing that we are trying to minimize that disparity in health equity in everything that we do. And as I've alluded to, the sort of partnership working, we need global cross-sector networks and communities, and that goes for every aspect of the work that we do. And Fanny said that we've worked really closely with NHS England, other research funders in this space, and there's a real collaborative network going on where we're all trying to answer the same questions, and we're all trying to bring each other along to make sure that we're all essentially trying to do the same thing, and we're all on the same page. There's no duplication of effort as much as possible, and we're working together to share good practice as well. So in terms of the funding, these are the 3 different areas that we look at. We've got the human health aspect, we've got health and care systems, and we've got research systems. And I'll just talk to each of those in a little bit of detail, just to give you a sense of where our portfolio lies. So in terms of human health, so this is really about sort of protecting against the sort of upcoming sort of impacts on climate change, but also those co-benefits that we can see. So these are a couple of slides from sort of the sort of recent IPCC reports, understanding the intergenerational differences that are going to be experiencing climate change. Also, the UK HSA has published its report on sort of upcoming and emerging diseases that could be more apparent in a sort of a changing climate in the UK that we need to start thinking about and being prepared for. But also there's these co-benefits, and I think this is really the crux of some of the work that we've done so far in this space, is recognizing those opportunities where both it's helpful for the planet and in the environment, and trying to sort of maximize that across all the care pathways that we can, because there are real mutual benefits that can be realized, and we just need to make sure that we're maximizing those opportunities. In terms of health and care systems, so this is both healthcare and social care. And it's both mitigation and adaptation as well. So it is both decarbonisation and also adaptation. And again, as Fanny said, there was from the heat waves, there were catastrophic IT systems failures. We know there's hospitals flooding, and that there's been some evidence on the amount of hospitals that are at risk of flooding across the UK. And also just extreme weather events in general. How do we ensure that health system and care delivery is continued in a world where our infrastructure is not currently set up to deal with it? So that's a really vital part of some of the funding that we're trying to do. And then, of course, there's the decarbonisation aspect. Now, I'm not going to go into this in too much detail because Fanny's done an excellent job. But what I will do is just highlight this slide. And this is taken from the Delivering a Net Zero report from the Greener NHS. And it's essentially a waterfall chart that sort of says where they currently are. And if along this side here, if they reduce the carbon emissions in those different areas, where they'd get to. And I just want to highlight the one that I've here, this is research, innovation and offsetting. So there is a huge chunk which is just assigned to the we don't know what we need to do. And just really highlighting that's, I think it's almost 25% essentially of that waterfall chart is just, we don't know what's next. We don't know how to do it. We don't know what the things are we need to do. And therefore really brings home how vital research and innovation in this space is in terms of making sure that the health system does reach its net zero targets. And then finally, research systems. So the research that we do obviously has an impact. And so as a funder, and how we're trying to grapple with how do we ensure that the research that we fund and the research that's conducted is done in the most sustainable way as possible. And so we do need research on this, and we need to work with other funders on this. And I think it's fair to say that clinical research is a little bit behind the curve on embedding sustainable practice as compared to healthcare and as compared to other sectors. But the momentum is building, and we definitely are sort of generating a lot more evidence on this. And certainly there's a couple of things on the right there I've just highlighted, where there's been fantastic work on sustainable laboratories in particular, and the Royal Society of Chemistry published their report, and there's accreditation systems like LEAF, which sort of have a grading system on how sustainable your lab is based on a few criteria that they have on their framework. And funders are creating their sustainability strategies on this. And the big thing that's happened last year was the signing of an environmental sustainable concordat across UK institutions. And this is an optional sign up. NIHR was a signatory from day one, along with UKRI, Wellcome, and some other funders. But it's essentially an agreement that you sign up to, and you can sign up to it either as a funder, as an institution, or as an individual. And depending on who you are, there are various criteria and things that you say that you are going to do by becoming a signatory to the Concordat. And a lot of that is about becoming a sustainable organization, making sure that you are environmentally responsible, but also as a funder, that we're doing all we can to ensure that the research and innovation that we fund is also done in a sustainable way as well. So that's a lot about sort of NIHR and what we're doing in this space. So I thought I'd just take a little bit of time to just talk about sort of actually what could, I said, what does a sustainable SME look like? But I said, what could this look like? And I think a lot of the things that I've highlighted here are things that sort of operating as a sustainable business, designing a sustainable product, and sort of having that product level carbon assessment. Those 3 points, I think, are highlighted because that's the need for NHS procurement, the roadmap that you've got for NHS procurement. You need to be a sustainable business. You need to be sort of showcasing your carbon reduction plan as a business. And then from 2027, 2028, I think it's 2028 that you are going to need to have product level carbon impact assessment of your products as well. I know that there's a lot of questions around what that's going to look like, but I think just that direction of travel. And the last thing I just want to sort of highlight, that is not just being a sustainable business, it's not just designing a sustainable product and knowing the impact of that product, but the thing I think that's currently missing, and the thing that we're looking at and we look at in our funding applications, and we're looking at trying to formalize this, is actually how do you measure the impact across the care pathway? Because again, as Fanny alluded to earlier, these don't happen in isolation. It's actually, and the models of care and the way that we actually deliver care is what we should be looking at, not just individual products and services, but actually across an entire pathway. What does that look like? So I'm not an expert in being a sustainable SME, but I think in just highlighting that there's a lot for you guys to think about in this space. You know, that the way that you could be responsible in terms of outside of just being the business, but in terms of your product, you can think about it from the design stage, the manufacture stage, the distribution, the actual use, single use, reuse, how many uses, and then also how it's disposed of. And it's just thinking about all of these elements, you know, material design and circular economy. It is a really complicated world, and we appreciate that. So I think it's just to say that we understand that this is a really complex area of work, and we as a funder are just trying to work out what our role is and how we can help support industry, researchers, innovators, to help them on this journey. So we are maximizing the amount of really good quality sustainable innovation that we fund through our programs. And carbon is a real it's not just about carbon, I guess, is what I'm trying to say, that it's currently the focus, and it's the focus of NHS England, and therefore I think has been the driver of a lot of the current guidance and frameworks. It's very carbon focused, but actually there are wider implications in terms of other environmental factors. Greenhouse gases are the current focus, but there's other things, you know, manufacturing, distribution, they all also affect air. Water is a huge one, especially, you know, we're thinking of a spring drought. That water resource, I think, is going to be increasingly something that we need to look at. Soil pollution, depleting of resources, and just actual physical waste production as well. So whilst the focus is carbon, and whilst all the requirements are carbon, I would just encourage anyone looking to be a sustainable innovator and designing sustainable products to start thinking about these wider environmental considerations. Because I do think in the future that this is something that we are going to be starting to think about and start asking evidence for as well. Not currently, and I'm not saying that that's something we're going to pin our hat and say that this is definitely what we're going to be doing, but I say the trajectory of the world is that we'd be looking at these wider environmental impacts as well as carbon as well. So yes, a sustainable innovator, what we're not asking much, are we? We're asking you to also identify the innovation that you want to do. We're asking you to operate, how you operate as a business. We're asking, how do you design your innovation with circularity in mind and designing waste out of that process? And then we're also asking you to measure the impact of all of these things. We're asking you to measure the impact of your environmental impact of your business by evidencing your carbon reduction plans. And we're going to be asking you to measure the environmental impact of your product in 2028. And we're going to be asking you about, actually, what does that also mean for the pathway as well as the products, the actual care pathway as well. So we are asking a lot. So we are looking at how best we support people going through this process. So what's our future in terms of NIHR and responsible innovation? So a big part of this is actually identifying what the gaps are and promoting those gaps so people know where the need is. We also need to provide the opportunities for funding. I said building capacity in the system, so making sure that there are researchers and innovators that are capable of sort of addressing those evidence gaps and needs. And like I've just said, that there's a lot we're asking of SMEs. So really, it's about developing what the most appropriate support for SMEs are to be successful applications in funding. And I think part of that is matchmaking people with multidisciplinary teams to ensure that those appropriate expertise that are needed in this area are appropriately matched as well. So we part of the last call that we've just done on decarbonisation, there was a real big focus on matchmaking, and it will be going forward as well. It's just bringing together teams of people that don't normally work together: chemists, geographers, clinicians, estates and facilities, all together with coming together with a sort of a question in mind to sort of try and answer. And then I think the big question in this space is actually, how do we embed environmental sustainability into health technology assessments, criteria for funding, and then also the wider question is sort of understanding sort of the health impact, the economic impact, and the environmental impact, and whether we can get some one grand unifying theory type equation to sort of get all of those things together. I think is unlikely. I think it's going to be a combination of different assessments. But I know that lots of people are working in this. We're looking at this. I know Wellcome are looking at this. NICE are looking at this. And NICE have already made some commitments to say that they are considering how to do this as well. So this is definitely on the cards. It's not going away. We don't know how to do it yet. But I just want to flag that it is really, really important to start thinking about from now, because you will be asked this in however X many years' time. This will be something that we will be looking at. And so I think actually, once we have a system in place, having environmental impacts as a core outcome of research and innovation we fund is something that is really, really important. The NHS is looking to be net zero. We can't start retrofitting essentially there's sort of 5 to 10 years, 20 years sometimes between the research and innovation that's funded and then when it gets into practice. If we're not already looking at how to decarbonize it or how that impacts in terms of the environment across the care pathway, then we are already on the back foot. So we don't want to sort of start retro analyzing and retro trying to decarbonize something. We should really be looking at it from now, what that will look like in the pathway in 5-10 years time. We don't know how to do that yet, but I think it is something that we are all thinking about how to do. So just quickly, what decarbonizing innovation can look like. I just want to focus because there's sort of, I think, 2 primary ways of how this could go. There's the sort of innovation that has decarbonization as a primary focus. So it is directly reducing environmental harm as a sort of primary focus of its research. And an example of that could be here, which is the nitrous oxide cracking technology for Entonox, which is the gas and air used in maternity a lot of the time. So this is a device that you just breathe back into, and it catalytically converts the nitrous oxide into nitrogen and oxygen, which is harmless for the environment. So that would be an example of an innovation that has a primary focus of decarbonisation. And I think where it gets a little bit confusing, and I think where we see a lot of this as a funder, is where decarbonisation is more of a secondary benefit. So the innovation or the research actually supports a care pathway transformation, and part of that might be a secondary benefit in terms of it's a digital tool, and therefore you reduce some travel. And I just want to say a point on that is fine. That is obviously part decarbonisation. But I think in terms of us as a funder and trying to fund research in this space, what's really important, and the ones that we do fund, have just not just said it's digital, it's virtual, therefore it's reducing carbon, but they've actually really considered this implication across the whole care pathway. And they've measured that. They've sort of said, this is the standard pathway. This is what my innovation or research does, and that these are the points at which it reduces carbon and by how. So it's not just saying it's a virtual and making the assumption that your product will say save carbon. It probably will, but in terms of funding that, we need the evidence for that. So in terms of funding, we have run the first year of our Decarbonising the Health and Social Care System call. The applications have closed, and we're just going through the first stage of committee funding for that now. This is an annual call for the next few years. So the second year opens in November 2025, and we're really keen to see more innovations and more SMEs applying to this. Part of the package of support that we did for the first year was sort of webinars and workshops, and we're looking to expand on those this year, and we're looking to do a specific one around for SMEs. So if you are interested in this, just keep an eye out. We'll disseminate it through this network as well. That we will I think we're planning the sort of launch webinar sort of October time, and then from that webinar we'll explain any other workshops and things that are going to be available. But we'd really encourage people to apply. We'd really encourage people to engage with us and also to let us know the support that you want from this as well, because we really do want to help people as much as possible and to be successful in this area. That's me, thank you. So that was a bit quicker than I thought. I will stop sharing. I'm around for the Q&A, but unfortunately I can't be around for the one-to-ones. But any questions at all, I'm really happy to be contacted. Thanks very much.
Thank you so much, Sophie. Really appreciate. I know you've had a very busy 2 weeks, so thanks so much for putting that together. It was really interesting. Great. I will just start sharing my screen again and get back to the main deck. Right. I'd like to introduce Dr. Catherine El-Zerbi. Welcome. Just realised we haven't been clapping for last 3 years. Yeah,
Yeah,
yeah, your
sure.
slides are on there. Over to you.
Well, hello everyone, and it's good to be on home territory. My name is Catherine El-Zerbi and I work as a Senior Research Fellow in Sustainability with NIHR's Research Support Service Hub, that's also known as the RSS, and that's with Lancaster University and partners. This morning, I'm going to talk about sustainability in health and social care research design. And I'll give a brief overview of the role of the RSS with specific reference to NIHR's carbon reduction guidelines, then indicate some further resources that you might find helpful if you're developing a funding application. Yeah, so NIHR's Research Support Service, which you'll hear referred to as the RSS, provides free and confidential advice to health and social care researchers, including industry, throughout all stages of the research process, from pre-application all the way through to post-award. So the RSS is a national service with 8 hubs, all offering methodological expertise, and it includes a specialist centre in public health and a specialist centre for social care. And to be eligible for RSS support, you'll be applying for funding to conduct health or social care research to either NIHR or any national open and peer-reviewed funding competition. So it's not just NIHR, it's any funder. So before I go ahead and talk about our vision, I just want to make a quick point on language. So what do we mean when we talk about sustainable research? Well, we mean it in the environmental sense. So that has already been alluded to by Fanny and Sophie. It means avoiding the depletion or degradation of natural resources. And it also means reducing or completely eradicating greenhouse gas emissions. So the overall aim of sustainability then is to ensure that what we do now in the present isn't jeopardizing the environment for future generations. So you'll also hear us use the term greener interchangeably with sustainability. And again, by that, we mean working in ways which are environmentally responsible. So vision for our RSS from a sustainability perspective is to support researchers in designing and conducting primary research studies that will lead to a greener health and social care system. And we also want to help researchers conduct all health and social care research in a way that protects our environment. And we're going to do this by highlighting to researchers or applicants key resources such as NIHR's carbon reduction guidelines, and by offering expert advice on integrating sustainable practices into research designs. We'll also support the development of sustainability-specific primary research, for example, through the discovery, development, evaluation of innovative green solutions, innovative new green methods and technologies, as well as green evidence-based practices. And here's our dream team. This is our sustainability research team. Not everyone's listed here. And it's led by Professor Cliff Shelton, who's a consultant anaesthetist and professor in anaesthesia and perioperative medicine at Lancaster University Medical School. And Cliff has been doing excellent sustainability research over the past decade and continues to lead and champion environmentally responsible practices in NHS settings and beyond. Then there's me. I'm an applied health researcher with a background in health inequalities, in particular green social prescribing alongside children and young people. Then there's Sarah, who has a medical background as well as a PhD in public health, and who, like me, is also researching planetary health alongside children and young people. And then there's Charlotte, who has a background in ethnography and interdisciplinary research, and she has expertise in food production and consumption, as well as consumer plastics. So that's us. So what support does the RSS have to offer SMEs? Well, we'll provide research support and expertise from a variety of methodologists, including statisticians, mixed methods researchers, qualitative researchers, health economists, social scientists, behavioral scientists, and clinical trialists, as well as many others with expertise in research design, as well as methods of analysis. And we offer advice and support. This is a really important point. We offer advice and support on including the public and patients in your research, in the design of your research. So from the very start, with your research question, we'd advise you to go and ask the public whether it's feasible and makes sense. We'll help to ensure that your research is inclusive, so includes underrepresented groups, less seldom heard voices throughout all stages of the research process. We also offer support in building a project team and in identifying appropriate funding schemes. Advice and support are also available on research impact, approaches to dissemination, addressing feedback from funding committees if you get through, helping you to find other sources of support and advice where we can't help, as well as identifying opportunities for collaboration. So as this is an event for SMEs, I thought it might be really useful at this point to mention our colleagues in NIHR's industry team. They work with companies of all sizes, from startups to SMEs, all the way through to global life science companies. So alongside the RSS, the industry team can help industry applicants with seeking relevant and appropriate funding programs for industry, linking you with relevant academic experts. The industry team can also facilitate patient involvement, which I've just referred to help you plan and design patient-friendly research. They can connect you with sites and facilities, including access to highly specialized research units through to sites within the NHS and community settings. They can link you with patients to take part in your studies, and they can help you to access and curate a range of pre-consented data sets and biobanks to enable you to conduct and deliver your research. So you can email them at industry@nihr.ac.uk. Yeah, so when you're developing a funding application, what we'll tell you to do is refer to NIHR's carbon reduction guidelines, which consist of 19 key recommendations for researchers. So you'll be glad to hear I'm not going to go through all 19, but I'm going to just draw your attention to some of them. The first is, when you set in your research question, make sure you've involved patients and staff, and ensure that you've made full use of the existing evidence out there to reduce waste and to improve research efficiency. Next, make sure your study's been designed efficiently by making good use of resources such as patient time, staff time, and do involve RSS methodologists in the design who'll be able to help you if you're not sure of anything. The RSS is here. Yeah, importantly, when you're setting up and conducting your study, make sure to listen to advice from those who are going to be directly involved in recruitment, such as patients, clinicians, or VCSE staff. This will enable you to optimize your procedures for recruitment and retention of participants, thus minimize waste and improve efficiency again. Also, avoid unnecessary data collection by clearly setting out what you're going to be measuring and why, when it will be measured, and how you're going to use the measures in your analysis. For clinical trials, make sure your trial monitoring is sensible, focusing on issues that are critical for the safety and well-being of your participants, as well as the reliability and validity of your results. And avoid inefficient or ineffective data monitoring practices, particularly those that require extensive travel to research sites. In terms of good practice, for reporting your research, make sure that you set the results of any primary research that you've done in the context of recent and updated systematic reviews. Also try to ensure research papers and reports contain the information needed to make them usable to other people, to your readers. And on reducing the environmental impact of your research, try to ensure your results and your outputs are rapidly and appropriately disseminated. And finally, as part of your research design, consider assessing the environmental impact of any proposed intervention or change to service provision that you've included within your study. So include that in the design of your research. So at the end of it, your output it's been carbon footprinted and we know what the impact's going to be. So here I've just indicated a few resources that you might find useful, sustainability resources, including toolkits and a really useful network hosted by the Centre for Sustainable Healthcare. There's initiatives which have already been mentioned, such as My Green Lab, the Green Theatre Checklist, and work on greener clinical academic trials led by our RSS colleagues at Liverpool University. And so to access the support we offer, visit the RSS website to register with us. We have a short registration form where we'll ask you for a few details. The QR codes are included here, and I think you're going to be circulating these slides. Yeah, so with all that in mind, the RSS seeks to support all researchers, health and social care researchers, including applicants from industry, in designing and conducting high quality studies for a greener health and social care system. Thanks very much for listening. Any questions are very welcome, and all the best with your future research applications. Hide down here.
Thank you, Catherine. That was amazing. It's really good to share all that support that's on offer, so thanks for sharing. All right, I'm just plugging this in because I noticed that the battery was running a bit low. Right, our final speaker for today, welcome Professor Ed Wilson.
Hi there. Good morning, is it? Good morning. I'm Ed Wilson. I'm Professor of Health Economics and Health Policy at the University of Exeter. I actually wear several hats. One of my roles is to run a review group for NICE called Pentag from Exeter. I also, and the reason I'm here today is I'm co-theme lead on the Health Tech Research Centre for Sustainable Innovation, which is based in the Southwest, but we cover the country along with other HRCs. And I'm also director of one of the hubs, the Net Zero hubs that Fanny mentioned in her talk. So my role today is to just give a brief introduction to the Health Tech Research Centre, and also I'll talk about a particular case study of how we've worked with SMEs that actually predates the HRC itself, but it's my colleague who is my the full theme lead for what we do, who has been involved in that. So it gives an example of what we can do. So just to acknowledge, Director is Mike Spiro and Chief Operating Officer Rebecca Harper. I am a lowly co-theme lead in the scheme of things. So the overall health tech research centres were designed to work with businesses, SMEs, to support the development of medical devices, diagnostics and digital technologies. So looking at things that enable people to better monitor their health, diagnose ill health sooner, and improve the management of conditions, including cancer, dementia, cardiovascular, and so forth. And so we're really interested in things that drive innovation and efficiency, bringing new technologies to those that need them most, can support the health and care workforce to reduce their workload, and anything that helps alleviate pressures on healthcare system are all of interest to the health tech research centres. We are the Health Tech Research Centre in Sustainable Innovation, and we are, in common with other HRCs, which I'll talk about how it fits in nationally in a moment. We're split between the Royal Devon University Hospital and the University of Exeter, and our theme leads are at the hospital and co-theme leads at the university. So we focus on a number of themes: rehab, frailty and dementia, diagnostics and biomarkers, digital innovation and artificial intelligence, sustainable innovation, which is where I fit in with my colleague Pete, and commercialization and capacity building, which kind of cuts across all of the themes. In terms of what we can provide, we have clinical staff, so we've got access to contacts in just about every specialty, both in the Southwest, but also nationally with our contacts across the other NHR organisations and NHS organisations. As per the, I was going to say the RDS, not the RDSs anymore, Catherine, RSSs, there's a big focus on patient and public involvement and engagement. So if you've got an idea and you need to actually try it out with patients or talk to patients, it's always a good starting point. We can, as per the RSS, we can also provide support and contacts for that. We're interested in technical solutions as well, so we can help develop with the innovators particular data algorithms and so forth. An example that we're working on at the moment is there's a PhD student who was looking at various sensors in muscles post-stroke and looking at how that can then predict later spasticity of the muscles, and therefore can that actually inform future treatment algorithms so we can actually put in place care, appropriate care, and so on. At the moment, it's at the stage where they know what normal looks like, they know what abnormal looks like, and so we're working with them to actually develop that into something that's more of a product that can be sort of a diagnostic product. Apologies, this is slightly screwed up. Collaboration and partnerships. Obviously work with NHS organisations and also the SMEs. We can help companies navigating the regulatory landscape, CE marking, UKCA, and so forth. And finally, support with grant applications. So expertise, advice, and review on applications as well. So in summary, there's a lot of overlap with the RSSs, but I think there's a lot of demand for the skills out there. So I think having a certain amount of overlap helps meet demand. Other areas of expertise we've got is we're sort of embedded within the NIHR ecosystem, if you like. So certainly down in the Southwest, we've got the Exeter Patient Recruitment Centre, Biomedical Research Centre. We've got PennARC, which is the Applied Research Collaboration Research Delivery Network for the Southwest, and the Clinical Research Facility. We've also got two particular facilities, one called V-Simulators, which is essentially like a virtual reality suite. And so we can work with innovators to develop interventions. For example, it's been used for falls prevention. So you can actually simulate an environment and simulate how somebody with reduced mobility can wander around that and navigate it. So you can devise interventions. It's also been used for sort of agoraphobia interventions, so VR interventions for social anxieties and various things like that. And then we've got the Morrell Gillings Centre down in the Southwest, which is a diagnostics suite. So we are one of 14 HRCs. We're kind of national in terms of we've got the different skills around the place. But there is a network which is built around core 6 functions, bringing the HRCs together. And the idea is to bring everybody together, strategic collaborations, coordinate across the health tech research centres themselves. Provides the focus for industry engagement, workforce development, patient and public involvement, and then marketing, events, and communication. Industry engagement is highlighted in that because my colleague Chris Fox, who is the co-director of the centre, is actually the national lead for industry engagement. So if you wish to talk to me afterwards, I can certainly put you in touch with Chris. So where do we fit in? Well, this is part of the NIHR's research infrastructure. We sort of go from this sort of invention to implementation stage, fitting alongside lots of the others. The focus really is on devices and diagnostics, whereas other organizations within NIHR have other focuses, but that's sort of where we fit in. So I'm going to move on now to talk about an example of some fairly successful work that's been going on a lot longer than the health tech research centres have been around, which is a company called SageTech Medical Equipment. This is a company that resolved a challenge about anaesthetic gases and the waste and the emissions from those. If you saw from some of the earlier talks, there's about 5% of the NHS's carbon footprint is made up of anaesthetic gas and metered-dose inhaler emissions. So those gases were traditionally vented into the atmosphere through anaesthetic gas scavenging systems. So how do we actually scrub those out? How do we grab those gases and stop them being emitted into the environment? Well, what the innovators came up with was a system where it actually, you pass the gases through what's called an aerogel, which is like a really, really fine sort of a silica gel type thing. But it's if you can hold a cube of it, it's kind of almost transparent. But when you pass a gas, like an anesthetic gas through it, it actually grabs the gas out of the air. And then they store it in these canisters. And then you can use what's called supercritical carbon dioxide, which is carbon dioxide that is at a higher pressure than normal. And you can get it to a certain state where it acts like a fluid. And then it's really good at then grabbing the gas out of the aerogel. And then you can reclaim the gas, recycle it, and then actually purify it, and then use it again and actually sell it as new recycled anaesthetic gases. So that's what their tech does. In terms of the story, well, this actually started from, just check my notes, because it was my colleague Pete Ford, who is the theme lead. He actually started with this in about 2015 with, it was an anaesthetist trainee who was interested in how to scrub these gases out of the atmosphere. How do we grab them back? So they spent evenings playing around with the anaesthetic equipment, eventually came up with prototypes. And it moved on to a more formal basis because it looked like this was something that was going to be a goer. So over several years, since 2015, Pete has worked with the what was his trainee to provide clinical access and evaluation environment. So had access to the machines, theatres and technical staff for testing various prototypes and stuff over the development. Enabled in vivo data collection across a series of evolving prototypes in genuine NHS theatre settings. So that was provided, that the facilities for that were made available. Provided expert workforce and equipment, so there was clinical oversight through the development from clinical engineers and ODPs, which Pete told me were operating department practitioners, and he described them to me as they were the Baldric to his Lord Blackadder. So I'm not quite sure of the relationship there, but anyway. Basically provided facilities that allowed it to happen to get to a prototype stage. And then when it came to formal testing, there was also the support provided for applying for grants and approvals and so forth. And then eventually the actual marketing of it itself. So as I say, that massively predates the HRC, but it's the sort of work that we do provide now in terms of supporting a business through from idea to development. So that's I think I've just about on time. If there are any more questions, there's a QR code to our website there and also email link. If anybody wants to ask me or to make any contacts to discuss any particular issues, I'm available, and I can certainly either help myself or point you towards the right person that can. Thanks very much.
Very well said. Those V simulators sound amazing. Love to go and try one. Brilliant. But can I get you and Catherine back on stage and we'll do a Q&A? No. Right. Have we got any questions from the audience?
Hello, can you hear me? Hello, my name's Joanne Dolezal. I've worked in research communications for many years. I helped to set up the patient recruitment centre here in Newcastle in a comms role, and then I worked in the central communications team with the NIHR. How important do you feel early stage communications is to the research process, and how do you envisage supporting SMEs to achieve that? Sorry, obviously a bit of a loaded question there.
Well, when any SME comes to our RSS, the very first thing we ask is, have they done any preliminary groundwork? Have they been present at the site and seen what's happening around? But importantly, for any feasibility study, I think we'd suggest that the research question is well, how do you do it? We do this routinely all the time. A focus group or a workshop in advance, 6 months in advance, with the view to having like a couple of these sessions where feedback and perspectives on the acceptability and the feasibility of the research question, the relevance of that research question to people's practices, gathering feedback, as I mentioned, not just from patients, but from staff, from everyone who's going to be impacted or affected by the research, and seeing if it's relevant to them. And then if it is, perhaps that's a valid question. Checking the acceptability of the language, sustainability. We've done it ourselves. It's not clear to everyone what is meant by that. Do you mean net zero? Do you mean decarbonisation? What do you mean by sustainability? So the communication aspect in the pre-application phase is so crucially important. That's the first thing we talk about with clients when they come to us. Also really important to minimise waste and improve efficiency in research design is gathering feedback on proposed methods and whether that's going to be feasible. I work with children and young people. That is standard. How would you like to participate in this research project we're thinking about doing? What would be fun? What would be engaging? What would be a good use of your time? Asking those types of questions. Otherwise, the research won't work and it'll be a waste, in my view.
Yeah, I think it depends what your objective is at first. So if it's a question of drumming up support or for the research itself to get the input, if you're got early designs for a feasibility study, I'm probably going to just duplicate what Catherine said, but yeah, getting people on board and communicating the ideas and getting their ideas to design your research in the first place is absolutely critical. But then, of course, it depends what stage you're at. If you're at the stage where you've completed your research, you want to make a noise, then of course you've got to shout about it, but you've got to have the data to support that. For example, if you've done all the studies, you've found that you've got a good product, found that it works, you've shown that it's value for money, you need to shout that to the NHS. So again, that's where the communications are needed. Of course, the loaded answer to the question is yes, of course, you need communications at all parts. at the different stages. Yeah. I think the question is, what do you want to achieve? What's your purpose? And make sure you design your communication strategy accordingly.
Fanny and Sophie, have you got anything to add?
No, I think that was very well answered. I was just going to say exactly same as Ed there, just sort of that targeted communication depending on what stage you're at, because that will vary depending on who your audience is and what you're trying to achieve. But I think that was very well covered earlier.
Great. Any more questions, Fiona?
Just firstly, thank you for 4 brilliant presentations. Just absolutely fascinating. I really enjoyed them. Just a question, but also a comment. Sophia, I wondered actually if I don't think you mentioned them about the Team Science Awards, but those feel to me like really great opportunities to build collaborations with people you haven't worked with, and just one of those opportunities, because I think, as alluded to in the previous question, you know, it's how do you make the connections, and how do you make the connections early, and particularly when we're fairly siloed. We've got small businesses, we've got researchers, we've got the public, you know, and actually it's connecting them to come up with ideas for solutions and research that can be quite, you know, at the moment it often is quite serendipitous, but I think the Team Science Awards are ones that give a really formal opportunity to bring together people you haven't worked with and see if you can develop ideas together.
Sorry, absolutely. There is actually one that's just launched around decarbonisation as well. So I can put the link in the chat. I should have mentioned it. You're absolutely right. It's a fantastic opportunity, and we're really grateful that this year sort of sustainability is on the agenda for Team Science Awards.
Thank you. And then my question was this: I hear whenever I hear around you know, different innovations, they often are around anaesthetic agents. I don't hear very much about nursing at all. And I just wondered if that's an area where there's a lot of uncertainties that were alluded to in the 2 first presentations, or if there's work going on. I'd just be interested to know.
So I can quickly, so I've just put a link in the chat to the funding opportunity for Team Science. So that's expressions of interest are open now, and the camp will be in September. So it's a 3-day camp where you're essentially tutored in the art of team science and collaborative working. So with regards to the nursing side of things, absolutely, really vital area. They're a huge part of our workforce that we need to engage with, and we do engage with, but we can always be better in this space. I think we talk a lot about anaesthetic gases. I think I am actually a former anaesthetist, and I think we were sort of basically highlighted as the only sort of area in medicine in the carbon footprint as like, you guys have a problem. And so for the beginning side of things for Net Zero NHS, and why a lot of work I think has been done on anaesthetic gases, is it was such a clear targeted area with a targeted demographic of people. It's like, this is your problem, what are you doing about it? And so I think that's historically why I think a lot of the work around anaesthetic gases has happened, is because we had a really clear focus and a really clear way of what we needed to actually sort of target for decarbonisation. I'm sure Fanny's going to speak to more about the nursing director, but I know that there's a lot of work going on with the nursing directorate in NHS England as well. But in terms of research, we absolutely are trying to make sure that nurses are involved in the researches that we are funding and the innovations that we're funding, and so that's much more about making sure it's accessible. It's about matchmaking. Because this is a really new area, what we're finding a lot of is we've got people with really fantastic ideas, sort of nurses, sort of estates and facilities management, who have no idea, have never applied to NIHR before, but they don't have a team. They're sort of a solo person in this really quite complex landscape. They've never really, some of them have never done research before. So it's about trying to bring those people with those ideas into teams that exist. It's matchmaking them with people that have got the expertise in sort of application writing and sort of grant application, but not necessarily sustainability. So it's bringing all of those people together, and that's across disciplines and across the multidisciplinary team in the NHS as well. We absolutely need nurses on board with the research that we do, and especially when you start thinking about sort of procurement. You saw how big the procurement footprint is for NHS England. Procurement nurses and nursing staff are the ones that deal with it far more than academics and doctors. And so we absolutely need those people on board with our teams for that to be an effective piece of work.
And perhaps to add from my perspective, I think we really recognise the kind of proportion of the workforce that nurse and midwives are. And I think another area of importance is to actually acknowledge the fact that they are the kind of trusted voice for patients. So I think it's just, from our perspective, is understanding what kind of framework can be developed to enable nurses to undertake sustainability projects and to kind of be the voice to support this particular agenda. There's been some work done on intensive care that kind of brought lots of different nurses, but I think, understanding that this is also applicable to different specialties, but just to understand, what can be done and what nurses and midwives can do to support the net zero targets. And I think the other interesting aspect is sometimes I think it's the issue of awareness, but sometimes it's the issue of time. And there's lots of discussion of understanding how we can actually enable nurses to undertake some of the sustainability work, whether through hybrid roles. We know some clinicians are also researchers, and how that could work actually for nurses. So perhaps thinking about how we can think of the role of nurses within the sustainability agenda and enable that in the future. So that's some of the sort of snapshot of the work that we're doing.
Have we got any questions online?
So Olasai Oyeni, hope I pronounced that right, would like to ask if this inclination to green and energy efficient could lead to organisations including healthcare reducing investments in infrastructures that have high CO2 emissions.
Sorry, I'm just trying to understand that better, but is the question around decision making for investment around energy and infrastructure should be led by how many carbon emissions, or led by carbon emissions, and perhaps making decisions on reducing investment for high carbon emission decision making? Is that the question?
After that, I'll ask him to expand and I'll come back to this one. I also have another question.
Yeah.
Category 3 carbon assessment is a huge undertaking, and I was wondering what sort of support is offered to SMEs to undertake this level of impact assessment, as most SMEs are not capable to funding such efforts. That's from Kevin Flanagan.
Yeah, I mean, scope 3 is complex, but currently it's actually not complicated, because we're not asking companies to undertake a full scope 3 emissions assessment. So there's only a subset of specific activities that can be looked at the moment. So things like, some transport upstream and downstream, and specific activities. So I think it's just understanding what has been asked from companies around scope 3, and then looking at some of the guidance available to be able to access that. And there's a few things available on NHS England's website that I can put in the chat for your information, Kevin, maybe to look at, because it's been designed not to be onerous from a scope 3 perspective at the moment, and just taking in small steps for organisations to come on board. So I'll put these links in the chat, just need to open them.
As my hat is the director of one of the net zero hubs, there are companies that we're working with or in communication with that actually provide that service, and one of the guys took me through their system. It's basically, it takes 30 minutes. And I think they charge like £200 or something, although you might be able to get it free of charge elsewhere. But basically, it just takes basic information about your company and gives you a skeleton carbon footprint. It's quite a clever thing. Free options may be available. Check out the NHS England website, but there are companies that will do that, and it's a fairly simple process to get the skeleton there.
We've got a clearer question here. The question is, should they reduce investment in pharmaceutical production and medical devices infrastructures that would have high CO2 emissions?
It's an interesting question. I think if it's just pharma related, I think that's pushing it back to the kind of supplier. And we know that there's support and funding available for greener manufacturing and greener processes. But I don't think we are at a stage where we can really sort of enable that in terms of the decision making and the investment. I think it's just understanding what we're able to do, what we're also able to do in the UK, because that would kind of reduce the transportation of pharma product. So I think that's just a really interesting point, and you know, it might be at some point that's where we go, but I think we just need to be very, very careful, because ultimately here we're trying to make sure that we reduce carbon emissions but deliver safe and good patient care. So I think we just need to be really, really cautious on what investment is being made and what decision making is being made, investment, clinical. So yeah, I don't think we're quite there yet in being able to transition that, but there's certainly a lot of initiatives ongoing to support greener manufacturing and greener processes.
I think we're going to have to finish it there because we're running a little bit over already, and we've got our one-to-one sessions. I will just go through a couple more slides.
So thank you everyone for attending. Hope you found it really useful, and thanks to our wonderful speakers. Brilliant. And if you don't mind us sharing your slides, I will send them around to everybody, as well as a recording of the event. That's our next one that I mentioned earlier, public patient involvement and inclusivity, which is very topical. We've got a really good sign up to that already, so I will share details in the email follow-up of how to book onto that. And as always, please follow us on LinkedIn, X, Facebook, Eventbrite, and take a look at our website. We've got loads of news stories, events, opportunities there for you to get involved with, and we'd love to see you at our events. And that's it. Thank you very much.